With us, Executive Director and founder of Isaroon, Fartun Welly. I think anytime we're able to have someone who comes in but is also a founder of an organization, it's a really special conversation about what they have to bring. Isaroon, just quickly, is a grassroots organization working for the health and connectedness of Somali women and girls so they and their families can thrive in Minnesota and globally. Through Isaroon, women and girls build their own health and wellness, economic self-sufficiency, community engagement, and leadership. Today, the sign-in sheet is a little bit different than we've had in the past, and that's actually because our guest needs information for a report that...
I think we can eye it out, but
okay.
I let them know if you want to follow us Facebook or shoot us an email through the communication. That would be good.
Good. So just everybody be sure to sign in this month as well. And then I'm going to step aside and give the full hour to our guest.
I won't put you to sleep after you eat Afro Deli. You really need to still move around. So I'll make sure that I don't talk much and I'll give you time to ask questions. Thank you, Jennifer, for inviting us. This is the first time I came to this campus. I usually end up at the other side of University of Minnesota, and so let's just get going. I couldn't help it. I just had to get this penguin and try to be funny. And so it says welcome, and the words that are near is Somali. It's also welcome. It says Sodowo. Role, you're already, the demographic you're already open-minded and you want to conquer the world and change the world. So your age group gives me hope. So, but today, if there are any burning questions or anything that you have, what you believe, what we've seen on the internet, just leave it out and just be you. And as we go through this presentation, I feel like a professor lecturing, which I would love to do someday, but not now. To just really be open-minded, and then, so what I would do is, if I'm technically not challenged, I'll get to a video. Jennifer, you may want to come here. Any computer that isn't mine drives me crazy. But I think I got this one.
Isaroon, a strong woman who can take care of herself physically, emotionally, socially, and economically. Since 2010, our mission has been to make sure Somali women and girls have real opportunities to build self-sufficiency and social connectivity. With those qualities, they can live healthy and productive lives to help Minnesota and the world thrive. Isaroon works from a strength-based framework. We reject a need-based framework because poverty, trauma, and victimhood never define our essential dignity. Despite the hardship of war and famine, Somali women are driven to do better for their family here and in Somalia. That's why we work with women and girls to build on the capacity they already have for economic betterment and social connection. We change their lives through 4 core areas of focus. First, we conduct community-based participatory research to capture the authentic priorities of the Somali women. Second, based on those research outcomes, we develop culturally specific health and economic literacy programs. These programs serve as blueprints for achieving true self-sufficiency and social connection. Third, we influence systems-level policy by educating elected officials and private sector leaders about the specific needs of Somali women and girls. And fourth, we build cultural bridges through civic engagement activities that increase connection between communities and families that are ordinarily isolated from one another. Isaroon then combines these 4 focus areas to create new and sustainable opportunities for all of our beloved communities to build each other up. We do this work to honor the legacy of the strong women who overcame obstacles to help us survive and thrive. Let's become our models, a strong, independent woman who serves her community with courage, generosity, and trust. We are Isaroon.
Okay, I'll get back to where I was. Um, just go back to that. So when Jennifer called and said, you know, we want to talk to the School of Social Worker, I was like, yay, of course. My background is a public health. I've been here since 2000. So I call myself a Y2K immigrant. Most of you maybe weren't born yet, or maybe you were. But I've been here 18 years, and I was at a school for almost, I would say, 13 years. ESL, learn English, do all the whatever requirements you need, do my liberal arts. I did my undergrad project management, knowing that I was not a good organized person, but back of my head, I always knew that I was going to work for the community and deal with time scarcity and resource scarcity. So I zeroed in, even though I'm really not a detail-oriented person, I did project management just to learn, to push myself to really learn how to organize. And then I did my master's in public health. But my background really, healthcare. I worked at Methodist Hospital for 13 years. Started from drawing blood as a phlebotomist, that's the skill I had, to working on electronic medical records and ICU, and then ended up training providers to utilize moving from paperwork, utilizing MARS in paper into moving into electronic medical records. So in 2010, early 2010, I had premature ovarian failure, and I went through menopause early age, which had been very hard. I love children, and when the thing that you like first, best that you don't get, and then you go through menopause at age 29 or 30, what I was, I don't remember. It was hardship, and then I realized how critical to have babies is so many communities, especially my community. And I worked at Methodist, so because I'm not a Christian, the best time for me to earn more money was the Thanksgiving, the Christmas, any holiday I'll just do double, because that was a good money. And then I realized I had this Caucasian woman and a Jewish nurse who would do the same thing with me every year, like 11 years. So I asked her, I said, what in the God's name, why can't you celebrate? And they said, well, we don't go home because our parents rule over our sister and our brothers' grandkids. So it was a reminder that women who couldn't conceive was really kind of a struggle for anyone. And then I said, okay, we bring more than just what our uterus can produce. And so I started Isurum really thinking about that women are more than, how many babies they can produce. And the word Isurum means a woman who takes care of herself. And at that time, I was really in deep depression and going through menopause, but also not realizing how much the community judges. So it just became really women-centered, human-centered, and focusing on the Somali women that I know. And then working at the hospital, all I've seen was all these poor immigrants, or boo-hoo. And I was like, not this woman I know. They're really smart. And people only know deficit-based approach because that's where all our programs are structured. It's like, oh, they're poor, they don't speak the language. But if you turn around and say how much you already know, their eyes lit up and they will tell you so much of creativity. And that. So I really did not like the disconnect. So then Isurum, I started, and it was something that I struggled. I quit my job and was a volunteer executive director for 5 years. So I do not tell you, do not quit your job. You're passionate about something, just pay your student loan, put some money away, then you can think about your passion. Please, I beg you. But when people talk about Africa, they think it's about one country. So I just put the continent there to give you some. I'm sure most of you know, Somalia is in that little corner, East Africa. So just when people say Somalian, there is no Somalian. The language is Somali. people are Somalis. So I even give the like a dirty look with our young Somalis when they say I'm Somali, and I said no, you're Somali. Please get your act together. So, and I love them dearly. So in ethnicity, really, this is who we are. We're very, these are our ancestors. You can tell women are beautiful and witty, and that was like 1900s pictures. And we're Somali, we're Muslim, and I'm hoping that someday I check my DNA, because some people think we're not pure African, but it doesn't matter. We're from Africa. We're a very proud group. The gender role, oh my God, the Western world, they think, Muslim women are, oppressed and this and that and that. Yep, we grew up where our dads were the breadwinners and moms stayed home. That's my mom. But, the gender role had changed. In Somalia, maybe the girls are not still getting the opportunities of education they want, but in USA, and the war had shifted the gender role, because men went to war, and then women, what do? They had to take care of the family, earn incomes to Somali women. And mainly, even if you look at USA history, the World War I and World War II helped women get to the factory jobs. It started a movement of earning income. So sometimes war is horrible, but sometimes I feel like all women war creates opportunities of leadership for women, which is a terrible thing to say. But historically, that's what happens. Again, I'm doing a parallel. That's a 1940 picture of a nomad Somali woman. And this is, one of our Somali first models. Parallel, if you look at, the time had changed, but it's still, we are a bunch of very proud culturally, conservatism really came in to show the clothes we wear and all that during the war. But, we're 100% Muslim, but still the value of clothing and how you cover yourself and all that seeped in during the war when, we were very vulnerable. And I cover myself because I can. If I don't want to, I'm in anywhere, you don't have to cover. But before the war, as I remember, some women did not cover their hair. They were showing their arms like that beautiful woman is there. So war changes a lot. But when you're in war, there's death, there's famine, there's all that, you tend to become more religious because everybody thinks they're going to die, so they may say, I'm going to get closer to God. So estimated, Somali demographics from the United Nations, the war really killed many people, and now Somalia is I think we're number 2 or number 3 about infant mortality is 1 in 4. Infants don't reach year 3. And also 1 in 8 women die in labor, so we have high infant and maternal mortality. This will help you as you're going to be in your field. Getting the background information is going to help you, because then you will say, oh, if they came from an environment where 1 in 8 or 1 in 9 women die, it could be higher because the rural areas nobody is measuring it. So, and then we're that's about it. And then the younger generation is, if Africa's data, we're really very young community. Here, more than 60% were below 30. So you're looking at a very young community so then you can tell when it comes down to college, when it comes down to jobs, we're really going to be playing a critical role. Does anyone know what the differences between Islam and Muslim is?
Islam, as I understand, is the religion, and Muslim is the person who practices Islam.
You got it. Sometimes when you hear what the media says, I just roll my eyes and I wish that person can see me. It's really important that you as you're going to go to places and you will see patients or you will work with clients, it's very critical that you understand the differences. And as the media and all this crazy rhetoric, it may influence your parents, the communities, the churches you go. It's really important that you understand what the differences are. And as you're going to be in school of social worker, the faith of a Somali person or even non-Somali person, it really helps part of the anxiety, part of depression. You can't just think about medication. You think about what kind of a way of spiritual that they use. So understanding the differences instead of saying, hey, you're Islam, so you may want to read, this Quran. It will be better to understand what audiences you will be working. Somalis, we're oral community, very much so. Poets, telling stories. One example will be if a patient or a family has one bad experience on one clinic, on a school, or anywhere, it spreads out like nobody's business. And I've seen clinics where they mistreated Somali women and their families, and the clinic's patients went 15% down, literally, because we rely on each other's communication. And when you realize that you're going to translate a sheet and you're going to give it to patient, I tell people, don't waste your time. You may want to calculate how many you're going to translate into English from Somali, hire a part-time person who can communicate. It's not like we're illiterate. It's that human 101, it adds authenticity, and that's what we're missing now in the care. So think about, as you're getting into the field, or maybe you're starting, think about if a community is oral. We still write, we still went to school, but it's the best way to deliver messages that if you're teaching, it's oral, visual, they have to see, they have to touch. There is no disability involved, but that's how it is. It's a Native American, and many people, ethnic people do that, and that's one of the reasons we have a lot of health disparity. Everything is became like a virtual. Here, you read this, there's no human connection. And the war, you've seen it. It's really, now Somalia is a little bit stable, but we have weird forces that would not let Somalia still to become stable. Yes, we have a corrupted government. And I know America is not really the moral authority anymore. Sorry. Yeah, we're non-bipartisan, by the way. This was my own. This is our own. Yeah, don't record that. Challenges, racism. We attack that right away because people cringe, whether you like it or not. Minnesota is called inequity, it's called disparity, it's called OMG, we have 45, whatever. Racism is reality. We just had a data that showed that still in 2018, Black person, Native person, pain complaint are not believed. I witnessed my older brother had a hip replacement. The hospital I worked kept him wailing for 6 hours after he had a hip replacement. So I witnessed it, and then the family's location missing those things, and then during the war, as I told you, we have high female household lead. So the Native Americans, Somalis, African Americans, we're immigrants. The war had made us, but then you have natives and African Americans who the racism and the system inequality perpetuates. So we have a high female household lead. What does that mean? It means that you will have a single family that led by women, and you really need to think about when you're designing a plan around that. It's not deficit. Focus on caring the household for her screening, what services they need, communicate. Tell them what do you want, learn from them. Believe in, because she's probably at the doorstep of what she wants to get in. Ask her right now what hurts, not the pain, but what are her priorities. And we talk about health disparity. I'm thinking I only brought 30 sheets, but some of you may have copies. I'll send more. We did a research a couple of years ago to really compare contrast. USA healthcare system and Somalia's health system and the belief system. And it's a day and night. Literally day and night. But then if you look at the Native American and you look at the white developed healthcare system, it's the same. You look at the African Americans, it's the same. The reason that we're talking about cultural relevant, culturally specific, is not hiring a black person and having a white design system in front of it. It's a joke. That's what usually now happens. Or we're so diverse that we can hire a person to lead this clinic, but every delivery, everything is led by and was designed for middle-class white people. That doesn't address health disparity. Look at here. If we just even check prevention, we talk so many prevention. All we're talking about is curative. I'm not going to see a doctor until I cannot get up of bed. Why should I? I'm feeling good. Probably if my anxiety kicks in because I have anxiety, unless I know the symptoms, and sometimes I be so lazy that I don't address it right away, and then when it's full blown and kicking me around, I don't see a doctor. I'm going to say, okay, what do I need to do? I got to exercise, I got to eat healthy, I got to meditate. I know those things. But not everyone knows that. So mental health is another whole monster that we're going to talk about. But prevention is not part of who we are.
I thought the lecture was great. I knew Issaroon was operating in the community, but I didn't know the details of what they did. So it was great to hear. And the director is very engaging and funny and thoughtful, so I think she's a great face for the organization, and it was a great experience to get to hear her talk.
Hi, my name is Michaela, and I really enjoyed the presentation today. I thought it was really important to learn about health issues that impact the Somali community so I can apply them to my social work practice.
عليكم سعودية لدها أني نحل كان أرتيا كأهي for Masters of Social Work, and I heard in Fartoon speak, and it was really wonderful to see her be here and speak to all the other students of how we need more diversity and to learn more about the Somali culture.